welcome, and many thanks to each of you for taking time out of your busy schedules to join us for this series, Finding Hope and Meaning Through Stories during the COVID-19 pandemic. I wanted to thank everybody for rejoining us, and we're going to discuss technology or innovations that you've seen currently that look transformative for the future as a result of COVID. Helen, we're going to start with you. Have you seen any technology coming up in your purview right now that may last into the future as a result of COVID-19?
You know, in terms of technology, I think the biggest advance that we've had, and the one that excites me, is screening for infection. You know, I'm an infection prevention advocate, and this is something we've really urged for a very long time. So if COVID pushes us to get effective, rapid diagnostic tests, that would be an enormous step forward. The problem with that, and the flip side, is that FDA regulation and approval of devices has been very, very lax, and we're seeing even those requirements relaxed, which has created a lot of problems with these tests. So we're going to have to learn to strike a balance there, because we need to keep dangerous and ineffective things off the market. And right now with the test, I don't think we're doing that. But if we can get good ones, and there's no reason why we can't, there's no reason to stop with COVID. Waiting around the corner for us is antibiotic resistance. And it's not really waiting around the corner, it's in the hospitals. And in the community. We need to be able to apply technology to the many other dangerous antibiotic resistant infections that we have. At this moment, infection prevention is finally being given the respect that it deserves. And if we can put the full force of technology at its service, we can finally maybe give it the power that it needs as well. But I'd also say, and I don't want to be too pessimistic, but I think we as a society have been really dazzled by the ideas of technology and innovation. And they often, if not usually, fall short of expectation. If this pandemic has taught us anything, it should be that reality is more important than spin. We have seen hospitals collapse under the weight of having to provide true emergency medical care. We've seen devices and treatments just not working. We've been really floundering. We've seen people panicking when that was not helpful. And reality really consists not of gadgets, but of the heart and the soul, and what people are doing in relation to each other, how they're organized, how they treat each other. So in some ways, we've been pushed back into the pre-industrial, maybe even medieval era by this pandemic. And we've learned that our technology is fragile. And we need to remember that there are things that endure beyond technology, and that those are the things that are at the core of what we call systems thinking. And that's mission and vision and preparedness and compassion.
Thanks, Helen. That is a great reminder that humans are still in charge of the technology, at least for now. And I think we've pointed out a number of times now that this pandemic has really pointed out weaknesses in our healthcare systems, but it's also pointed out weaknesses in our FDA approval process for devices and technology. And when I say weaknesses, I also think of opportunity. I think what I've been amazed with is how quickly some of these things have come out to be tried, even though they had failed. I don't know that would have happened as quickly in the past. I'm hopeful that the trial and error process is only going to accelerate, but I keep in mind, to your point, that it's humans behind it, and we've got to be mindful of that as well. Steve, I'm going to ask you the same questions. What technology or innovations have you seen? I mean, you and Margot were in the hospital yourselves during the midst of all this. What would you say you've seen?
You know, Marty brought up the idea of telemedicine, the question is about what's going to be transformative. And I'm seeing, like Marty is, and I'm sure all of you, there is this surge for telehealth, telemedicine, especially right now, because people aren't going to the doctor, they're not going to the hospitals, and there is absolutely a time and a place for this. And I speak from absolute personal experience. I'm very concerned about this too. This is cautionary tale part 2. It all sounds good. Hey, you know what? You're afraid of COVID. You don't want to get sick. Let's have a doctor's appointment on the computer. Margot's going to have one next week, in fact. Sounds great. But my question is, when is telemedicine, when is telehealth or teledoctor, when is it appropriate? It seems like it's appropriate now, but I can tell you that my mom was in a hospital being watched by telemedicine, the EICU, the electronic ICU, and this hospital didn't know my mom was in a coma for 2 days. This was a major hospital, not a clue that anything was wrong with her. So what I've learned is, I just think we have to be, this is a very slippery slope. We have to be very careful as we go toward this, which I think this telemedicine thing, it's coming on strong already. And if I've learned anything over the past 10 years is you cannot properly assess, and I say this not as a doctor or an attorney, I'm none of those, but I've learned from those doctors and attorneys, healthcare providers and nurses and all the great medical practitioners I've met in the last 10 years that you cannot properly assess or manage a patient, especially a critical care patient, through a camera, through equipment. Good luck. It's not going to work that way. Mistakes will be made. It's better than nothing in some parts of the country where there's rural, when there's no hospitals and you've just got these little emergency rooms with no doctors. But there's a reason that we see all these incredible, heroic healthcare providers dressed like, they're on Mars in hazmat suits in these hospitals, is because they know that the hands-on cannot be replaced. And I think there's a lot of patients out there who haven't experienced certainly what, I have and what Margot has. And like Josh said, people haven't felt it. Be very careful with this telemedicine stuff. To me, there was no oversight of this thing. Certainly with my mother, who's overseeing this surge in telemedicine right now? Margot mentioned something about the Wild West. I agree with her. It's the Wild West. And I think we need a sheriff. And like any good town full of good humans, we need some oversight. We need someone at the national level, in my opinion. This state thing, the state-to-state thing, I don't know. That's like 50 Wild Wests. I'm nervous about that. Having said that, I also agree with Helen 100% that, I don't want to put words in her mouth, but I'll paraphrase my own thoughts. People are going to save us, not technology. You can invent the greatest machine in the world, but if the person who's working it doesn't know what the hell they're doing, who cares? So it's going to come back to the human beings, the loving, compassionate humans. They're the ones I'm going to bet on.
Great answer, Steve. I can't think of telehealth and all the progress that we're making with it without thinking of your mom, and immediately see the potential pitfalls of that technology. And this human behavior has come up multiple times in this conversation today. Humans are going to drive any artificial intelligence that is built too, so we are the heart and soul of technology. I remember writing articles for trade publications 10 years ago about the mobile health apps that were coming out, and everybody was so afraid of the wild west of mobile health. It's 10 years later now, and maybe that's a question for another panel, but how do you think that mobile health has evolved in the last 10 years? Maybe that's an indicator of where telehealth may go or could go, provided the right people are in charge. Mark, I'm going to go to you, since you've had similar experiences to your husband. What innovations or technology do you see will move us forward and out of this, or hold us back?
One thing that I've been thinking of is as a layperson, I'm not intimately involved with all the, technology that they're developing for all these different systems, but I think it's shown the importance of communication and the isolation of having COVID-19, which I'm sure Josh can speak to better than I could, but you see stories every day about healthcare workers, the people in the hospital stepping up and helping the patient communicate with their family, and the healthcare workers are getting more intimately involved with communicating to the families. And I hope this is a lesson that we learn going forward, is how important the communication is. Most of these stories I've heard are people who really care and who are totally dedicated, but that then puts a spotlight for me again on the negative. I'm sorry, but with the people who don't necessarily have that empathy in them and the sympathy for the person lying there isolated and alone and scared, and how those people who we never hear about the stories, they're just passing away or struggling independently alone. And I think going forward, no matter what technology is developed, I think we have to remember how important the patient experience is. I've had my foot surgery and all that during this time, and just seeing the workers in my doctor's office, they care, and it makes a huge difference. And I'm not isolated like a lot of really sick people are, but it does make a difference. So I hope that this is something that, and it's not something you can, I don't think, regulate, but it's something that I hope that can carry forward as we move forward.
Marva, that is a great point. Patient experience should be at the heart of any innovations or technological advances. I think if we look at it through that lens, then we will be successful in that arena. And this is actually a perfect segue to my co-host, Marty, because patient experience is definitely one of his many areas of expertise.
Thanks, Tracy. Thanks, everybody. Really interesting to listen to the comments so far. I do think this is going to strengthen the need we have for patient and family engagement. I think people are going to see that that's more and more important as one of the outputs of this crisis. Josh, I'm going to ask you one other follow-up question. Some quick thoughts about the role of technology going forward. Do you see that changing or its uptake and use in healthcare more as we go forward?
I was thinking about this in my own experience as a patient as I went to these different places to get treated. So first I went to the ER, and then I went to a follow-up visit with my doctor. And then my doctor's office had set up two separate, a respiratory side and a general medicine side, so separating COVID patients from non-COVID patients. And I've been seen by 3 or 4 different medical facilities over the course of the last 7 or 8 weeks. And one of the things that's really strange to me as someone who's built a software company that does customer engagement is we think a lot about, in the software industry, about the customer life cycle. So what are all the important events in someone's journey through a product if they're a customer of a company? And this is something that most companies will map out. And I think it was strange. It struck me as strange that as a patient, there was no sense of following up automatically these things that, oh, Josh has done this part of his COVID experience, so now these 2 things need to happen. And that's the way that a lot of businesses think about the customer journey, but it feels very disjointed. And a pulse oximeter would have been one of those follow-ups that now I think is such a no-brainer. Chest x-rays were also very confusing and would be another no-brainer, as well as just some generalized follow-up to see how I'm doing and to give me some guidance about what I should expect. All those things rely on data systems, which need to map a customer journey. And that has to do with, well, where does the data live? And does the data get joined and talk to the other providers? So I think some of those things will enable a different kind of patient experience once they're in place. And that is exciting to think about. I think it would have been easier if that had been in place.
Thanks, Josh.
So Tim, we're going to go to you now, and you may be in a very unique position to answer this question given your new position at RL Datex. What technology or innovations have you seen as a result of this pandemic that you think will really benefit the quality and safety of healthcare moving forward?
Tracy, thank you for that question, because I do think there's a lot of technology and other innovation that's happening very rapidly due to this pandemic. And I'd just like to share just a few of those. On the one hand, what seems pretty obvious is the need to convert to telehealth. And more, we're beginning to see the use of that kind of technology to get care as far and wide as possible, particularly when it's difficult for offices to be filled with patients and other situations like that. In addition to that, on the training side, I am seeing the ability to do live remote training around candor, around open and honest communication, empathy and compassion in ways I never imagined we'd be able to do this quickly. The other piece that really hits me, and I think it's very timely, is that RL Datex has a very prominent event reporting system and event management system. The other thing that I believe we've really begun to recognize is the power of it in terms of beginning to look at issues around implicit bias and racial disparities, in fact, that we see here with this pandemic. I think there's ways that immediately we are going to redesign the ability to take the data that's often in there to really create more impactful dashboards so we can begin to see very early on the issues around healthcare disparities. And now more than ever, I think that is really super critical. And then of course that will dovetail to the power and the importance of empathy and compassion.
Tim, all excellent points, especially the point about collecting data that really captures the inequalities and the inequities in this pandemic. The disease specifically is really affecting people of color twice, 2 to 3 times as frequently as those who are white. And I think that is something that we haven't been collecting enough along in healthcare, and it's important to do it now, especially with something so obvious. And as far as the technology goes, I think we needed a shove. The technology's been waiting for us, it's been there, and we would have done it much slower. The telehealth that you mentioned, especially, I mean, the technology's been there a long time. So thanks for mentioning all of that. And thanks for your time today.
You're very welcome, Tracy. Thank you again for this opportunity. Kind of following up on what you said is that, you know, necessity is the mother of invention, and the necessity was huge to begin to address this stuff. And I'm just very excited to be part of the change that we're going to see going forward.
Thanks again, Tim.
Anyway, Pat, we're talking about transformation, so I'm going to turn to you now. Transformation, and we're seeing it happen. I mean, out of any good crisis comes the opportunity for transformation. We're seeing innovation, certainly, and there's a lot of technological fixes that are being proposed. What do you see as the real transformative output of using technology or innovation that we have the potential to do now?
Thank you, Marty. And I do believe that telehealth does have a place in healthcare going forward. But like everyone said, we need to be able to assess its effectiveness, and making sure that it's effective for the patient as well as the provider, and leading to good outcomes of care. But I have seen in nursing homes where the physicians don't want to enter a nursing home, and yet the patients are in need. And some people don't realize that physicians only need to visit a patient every 30 days. And after the patient has been in there 90 days, it's every 60 days. So again, they get very little interaction. And yet a nursing home resident can turn quickly. They will turn quicker than any of us in terms of their health, their decline in health. So I think it does have a place. I also think that it was mentioned before, the need for infection control and prevention, not just in hospitals, but it should be surveilled the same way it is in hospitals, in nursing homes, and other healthcare settings. Because we find that, again, that's where people are also not aware of how to manage an outbreak and even detect an outbreak. So again, I think that's an area, and that can be also with some electronic communication as well. I like the idea of us moving to a fact-driven type of approach, identifying the gaps, the strengths and the weaknesses going forward. But I truly believe we need to get away from just perceptions and really have some data and information that we can work with. And also believe that the value of public health has increased. It had been on the decline, but now everyone realizes the role that public health plays, as well as the need for vaccinations, and also just even basic tracing skills and identifying the transparency with infections. Workforce safety is another area, but before I talk about that, I do want to say I was on a conference call this morning with the World Health Organization, and it was with all these leaders of developing countries, and their major concern is a little bit different than what we have here. Their major concern is they need clean water, because if they can't have clean water and wash and use soap, they're not going to be able to stop the infection. So again, it's a little bit different, but if we really want to be global leaders, we have to address other issues as well and help bring them along. In terms of workforce safety, as Dave Meyer mentioned before, I am concerned about the safety and well-being of our workforce, the ones that are working directly with COVID-19 patients. And we're coming up on Memorial Day, I want to reflect on something my son had educated me on. He was a ranger in the Army, served 3 times in Afghanistan, and was highly regarded, on a track for officer. And he said he left. He left the Army. And he left it because he said, if I go again to Afghanistan, I will never be the same. I will never get back to being any sense of normality. And I think that's something that we're forgetting, is that the nurses, the doctors who are committed to seeing everyone survive and thrive, that they're having to deal with so many deaths and so much intensity, long hours, sleepless nights, fear for their safety, but also the regard for the patients. So I do think that we haven't done enough in terms of mental health services nationwide, but certainly as well for our workforce, our healthcare workforce. So I think there's opportunities, but we're going to have to make some changes in order to be on the right path going forward.
Thanks, Pat, for raising all those issues. You gave us a nice laundry list, but I'm particularly grateful you brought the issue of mental harm up, because so much of the patient safety metrics so far have been focused on death and not the other kinds of harm that unsafe healthcare, to use Dave's term, produces. So thank you. Vaughn, I'm going to turn to you now. We've given you a lot of comments to think about, and I know you've been thinking about this in general, but when you scan your world, what technology, what innovations do you think are going to be particularly transformative or have the potential to be?
I would like to place my attention in 2 categories that I think have real relevance right now with regard to technological and innovative advancements, that will come from COVID. One is just I'm going to call it a human technology, or it's not necessarily an innovation, but I think a lot of people right now are attending to the state of anxiety in new ways. And I don't know if this is a trend. I have not studied it yet, but I intend to, because a number of my clients have, for whatever reasons, and they're different for each person, decided that they want to not use medications to manage their anxiety. I think there's a new understanding of anxiety. We have a new level of anxiety. And so what people were experiencing as anxiety before and managing with pharmaceuticals in many cases has a different, there's a reset there. And we do have the human technology to be able to both utilize medications and pharmaceutical interventions, but also just our own breath and our own nervous system. There are apps for that. There's good science behind it. And I think that we will see an elevation in research in that area. And I think that we will see an emphasis on just people really realizing that anxiety is very real. A lot of people haven't touched it directly until recently. And so our compassion level also goes up. Our understanding that this is something that we deal with as a society, as a human species. So that's one area that I hope will increase, both in terms of evidence-based science, but also just in practicalities of helping people through this time, but also the aftermath of this time, which is, we haven't even started to see that yet. And the other thing that I would like to point to is, I think many of us in this health safety frame of mind and have, tried over the years to really disseminate what we know works as broadly and as quickly and pervasively as possible. And it is my hope that some of the technologies that we're seeing being brought to bear right now that are disseminating information very quickly, even if it's new, even if we're not quite sure about it, even if it fails initially, but we're in an experimental mode because we really kind of need to be. My hope is that we really merge and get that obstacle out of the way, that we have to have privatization. We have to have confidentiality agreements in place. We have to be able to have people be secure that their experience, their situation is not going to be attached to them by name. And at the same time, our experiences collectively help us learn faster and help others learn faster. And it's certainly my hope that we can bring that technology together along with our human technology of compassion and kindness and, the hope for a better future for everyone together in a unified way. Because, as most of us who work in this field know, a lot of solutions are already there. Diagnostics, preventative, risk assessment, infection control. The list goes on and on of things that we actually know. And when a system prioritizes, it makes a difference. But we don't have universality with regard to the implementation of those practical and very real solutions. So I certainly hope technology is going to be able to focus on that, and that this experience with COVID will be inspirational in doing so.
Thanks, Wanda. I kind of took away from your comments a lot of hope that there can be this collective learning and collective caregiving that technology can foster. I think the potential is there. I mean, we have the tools, as you say. I just hope that we can spread that. So Dave, I'm going to turn to you as our last person. You've had a lot of food for thought here, everything from infection control to Fred to the divisiveness amongst the states to think about. What are your thoughts about what's going to change and what are the really promising innovations and uses of technology?
Thanks, Marty. And again, I get the benefit of going last and everybody else's great thoughts. I think I want to break this question up into a couple things. I believed before the pandemic that artificial intelligence and predictive analytics would lead us to a much higher quality, safer health environment. And I still believe after the pandemic, even more so, those types of advancements are going to help us. And I love Steve's comment. When you talk about telehealth, it's this giant term that everybody wants to use. Well, in telehealth, we've got communication tools. And as we're seeing at MedStar Health, we're doing over 5,000 telehealth visits a day. Great communication between physicians and nurses and patients and families on questions, on post-op checks, things like that. And we're getting over 97% five-star approval rating for that. Patients and families love it. You don't have to sit in a physician's office for 30, 40, 50 minutes waiting to be seen. You could sit in your living room and you get buzzed and said the doctor will be with you in 30 seconds. So that part of telehealth and communications, I think it will continue and make us a better health system. Then you get telehealth the way Steve was alluding to and what happened to Judy in the ICU with EICU. We saw the same thing when telemetry came out. Everybody thought telemetry was going to save all these lives. And in fact, data showed that after it was implemented, the mortality rates went up by 3 to 5 times. Because there's a great adage somebody told me that the best way to starve a pet is to tell 2 people to feed it. Everybody assumes somebody else is watching, and that doesn't work. Those platforms, I think, are scary, and we've got to be careful. But to bookend this with what Helen started off, and I think it was so right on, as you heard me say previously, we're printing trillions of dollars now after the fact. We're giving money to everybody because for 30 days, we delayed and didn't act properly. Nobody could have stopped this virus, but there are a lot of things that could have been done that could have softened the blow more than we're seeing today. Since we're printing money, let's take $1 trillion and put it into reopening the pandemic unit, readdressing antimicrobial resistance, which everybody's been warning us for 10 years is going to take this generation down. I don't care if you're the Gates or other leading scientists and virologists. Let's take $1 trillion and do something proactive. Let's put it into the NIH. And let's say we are going to build an agency that is just going to be concerned with antimicrobial resistance research and development and virology research and development. And I would keep it there. I would limit it to the academic medical centers because I get really concerned when I see the publish-or-perish models and the tenure models. And sometimes there's competition and the research doesn't get finished. Let's get an agency like NIH to oversee it and hire the best people in the world and have them come in and do what needs to be done. We have always had amazing research and development in this country. When we put the smartest people together, they do amazing things. And so, like I said, since we're printing money, let's do something proactive. And like Helen said, let's plan for the next big event to happen versus trying to wait until it's after the fact and then having to deal with the ramifications. We stockpile tanks and rocket launchers and guns for a traditional war that will never happen. Wars are not fought the way we stockpiled for them. Why don't we stockpile all this equipment and have it ready and waiting for the next event? The hospitals, like Helen said, why are we standing up hospitals in convention centers and all these places? It's just horrible, and we need to be more proactive. And so that's where I'll leave my comments.
Thanks, Dave, and thanks for bringing up that notion of proactivity. It's what I was trying to get at when I kept probing people about what's going to happen in the next election, because I do think that there is a lot of divisiveness, but there's also a lot of awareness, and this disease has touched a lot of people, and maybe the proletariat, the people will be proactive and really start demanding that our leaders, use data, drive science, implement the solutions that we have. That's my takeaway. And, I think it does kind of lead us into whether we're going to see more and more talk and more effective, proactive talk about why we want to have a national healthcare solution of some sort. But with that thought, I'm going to turn this back over to you, Tracy, to see if you've got any closing comments or additional comments of your own to add.
Thanks, Marty, and thanks again, everybody. I think a lot of great points were raised, and I think when it comes to technology and innovations for the future as a result of COVID, it's not only 3D printing, more shields. It's not only the speed at which we can create a vaccine. I think Pat and Vonda both mentioned mental health and how we manage our own state. Transformation can be behavioral too. And I think at the core of all the technology, we've come to the conclusion that human behavior is going to drive how that is implemented, how it's rolled out, what the goals of it are. I always think of, use your power for good or evil. I think that for now, anyways, humans are still in charge. I don't know. I think transforming our behavior is at the crux of all this personally. But thanks for everybody's input today. Again, it comes down to stories for me. And I think these stories are transformational too. So thank you for sharing yours and your time today. Thank you all so much for participating in our Finding Hope and Meaning Through Stories during the COVID-19 pandemic series.